Thank you everyone for joining. Welcome to the Year-End Reconnect webinar on health economics. And a special thanks to Professor Turchetti for organizing the webinar in such a difficult moment. So Professor Giuseppe Turchetti is full professor in economics and management of healthcare at the Scuola Superiore Sant'Anna. And today, Professor Turchetti will discuss with us about the economic evaluation techniques in healthcare. I would like to give you a few information on the webinar. As usual, the webinar will be recorded and it will be published on the Year-End Reconnect YouTube channel and on the Year-End Reconnect website. You see the link on the slide. If you want to be updated on the upcoming webinars, you can subscribe to our newsletter and you should be able to see the link also in the slide. If you have any questions during the webinar, you can use the question and answer session of the chat or the chat if you wish to ask your question, and Professor Turchetti will be available to answer the question after his presentation. After watching the webinar, we would really appreciate if you could participate to our webinar satisfaction survey at the link shown in the slide so that we can provide our webinar, improve our webinars in the future. Thank you very much in advance. And without any hesitation, I would like to give the floor now to Professor Turchetti. Thank you again. Please.
Thank you. Yes, thank you very much, Diana. Good afternoon to everybody. I hope to find you well, that you are safe at home. As Diana was anticipating, this seminar is focused on the economic evaluation techniques. This seminar follows the one that we had in February, where we describe the rationale behind the economic interest in healthcare, so health economics, and we highlighted the key topics that health economics is more interested in. One of those topics, if some of you were also at the previous, was attending also the previous seminar, might remember that is the economic assessment of a procedure, of a new drug, a new medical device, a new medical procedure, or a new healthcare program. So nowadays we will go through this agenda, just a very quick recap with the previous seminar, talking about why this economic evaluation is relevant, and then very practical, as this is the title of this seminar is Economic Evaluation Techniques, a Practical Toolkit. We will analyze how we can design and manage an economic evaluation. And then a final slide with a few considerations. Why we must focus on the economic evaluation techniques. If you remember, this was one of the slides I presented last February. And this slide tells us how the ratio between total healthcare expense over the GDP moves over the years, and its dynamics starting from 2000 to basically nowadays. And if you look at the data, we can very clearly understand that this ratio is going up. And is going up because of two main reasons. The first one is that the numerator of this ratio, so total healthcare expense, is going up. And there are many reasons that could explain why the pressure on the rise of healthcare expense is so strong. On the other side, the second reason is that the denominator of this ratio does not grow at all, or very a little in many European countries. And unfortunately, after this very tragic phase that we are experiencing, probably all the European countries will experience a decrease in its GDP. So in their GDP. So this is why the concern about the economic sustainability of our healthcare systems is really an issue that the different governments have to manage. So the key question in our countries, in our European countries, is how to satisfactorily manage the trade-off between innovation, that is one of the most important reasons that drive the healthcare expense, and the economic sustainability. Or just to say in this concept, to present this concept in a harsh way, how much innovation can we afford, and we will be able to afford in the next future. Considering that we, in many countries, we may not be able to afford all the different innovations that will enter into the market, drugs, medical devices, and so on, we will have to choose. And how to choose? We must choose relying on rigorous, robust, scientifically based evaluations of the different technologies that will enter into the market, or the different innovations, or the different procedures that will enter into the clinical practice. So we must base our decision on strong data, on strong evidence. So we must learn how to run design and run an economic evaluation. And this is the topic of this seminar. The rationale is clear. Now let's see how we can design and run an economic evaluation design. So first of all, what is an economic evaluation? Economic evaluation is an evaluation that has the purpose of identifying, measuring, comparing the cost and the consequences of a new product, a new technology, for example, a new procedure, or a new healthcare service, healthcare program, in order to support the decision makers in choosing the best alternative. So this is the main objective of this economic evaluation, and the main two characteristics of an economic evaluation are the ones that you see, you can read at the bottom of this slide. We must choose between at least two different alternatives. So there are always two or more alternatives we have to compare and we have to assess. And what should we focus on in assessing the two or more alternatives? We might assess or compare the two or more alternatives on their cost or their consequences. And these are the main characteristics of an economic evaluation design. We have to keep into consideration these two dimensions. We must compare two or more alternatives, and of each alternative, we must assess both, typically, hopefully, as we will see in the presentation, costs and consequences. In order to design an economic evaluation, we must follow these 4 steps. So it's a kind of a 4-step process that we have to follow. The first step is to define the perspective of analysis that we will adopt in running the analysis. The second step is to very clearly define the focus of our analysis. And in particular, as we will see in a few minutes, we have to define if we will focus on cost or only on consequences, and in which costs and which consequences, or both costs and consequences. The third step is to define, is to choose the technique that we will use in the analysis. As we will see, we have available different techniques, and each of those has its own characteristics and is well suited to answer to specific questions. So according to the question we have to answer to, we must choose the most appropriate technique. The fourth step is the sensitivity analysis. As we will see in the next minutes, running an economic evaluation means to make many assumptions. For example, the value of a specific variable that we use in our model of analysis. So what if the value is not the one that we used in the analysis? What if the value is x plus or minus something? So we will have to rerun the analysis using different values of the selected variables, and just to analyze, to measure if the conclusions that we have reached are robust enough to be used in order to take our decisions. So these are the four steps of an economic evaluation, and we always, when we design this evaluation, we always have to follow this path, this process. So let's start from the first step, the perspective of analysis. The point of view that we decide to adopt in performing our analysis is very, very important, because the same program may seem convenient or not, depending on the perspective that we decide to adopt. And in running an economic evaluation, we may adopt, for example, the perspective of the patient, or we may adopt the perspective of the medical doctor, or we may adopt the perspective of the hospital, or of the local health authority, or of the national or the regional healthcare system, or the perspective of the society overall. So it is really important to define at the very beginning of our analysis which is the perspective that we decide to adopt in running the evaluation. If a paper that is focused on an economic assessment of a new procedure, of a new approach, does not tell you in the very first rows of the paper which is the perspective that the authors are adopting in running, in designing their analysis, don't lose, or let's say, don't waste your time, because that paper is not robust, is not scientifically based. So this is the first message. When you design an economic assessment, you must, as a first step, very clearly define the perspective of analysis, the point of view that you adopt in running the analysis. So this is the very first step. The second step is to define very clearly the focus of the analysis. And as I said before, you may focus either on costs or on consequences of the two or more alternatives that you are comparing. So you must very clearly define the focus of your analysis. For example, if you focus on cost, you may, or you should, or let's say, you may choose among different families of cost. For example, you may decide to include in your analysis direct costs. Direct costs are costs that are directly related to the management of the disease, or to the management of the patient. And this cost might be direct healthcare costs or direct non-healthcare costs. And with respect to the first category, you may consider cost of drugs, cost of the tests, lab tests, or instrumental test, or the hospitalization, the cost of medical devices, the cost of the healthcare professionals that are providing the service, and so on. Or you may also consider the direct non-healthcare costs that are, for example, costs related to the transportation of the patient from his or her home to the gym for a session of rehabilitation, or to the hospital for a visit, or for a lab test. So these kind of costs are directly related to the treatment of the patient, or to the management of the patient, but are not in healthcare in nature, okay? But might be, sometimes might be very important. Or you may focus on indirect costs, that are costs related to the loss of productivity, or the reduction of the productivity that the patient or his or her caregivers may suffer because of the presence of the disease. So this is another very important family of costs. And then there are costs that are more intangible, that are more related, as we will see in the next slides, to the concept of quality of life. So costs of psychological and social nature related to the disease. So no matter which is the focus of your analysis, so the cost that you decide to include in the analysis, but it is very important to very clearly define which is the focus of the analysis. So which are the costs that you are including in your analysis. So you must define them, and you must very clearly highlight which is the methodology that you use in measuring those costs. So this is one issue. Or you may focus on consequences. And also in this case, you may have different families of consequences. You may have clinical implications related to different alternative treatments. So which is the clinical implication of treatment A versus the clinical implications of treatment B, or or those treatments may differ in terms of their psychological implications, or physical or mental or social implications. So you must very clearly define which are the consequences you are focusing on in measuring in a comparative way the efficacy of treatment A versus treatment B. So this is a very important step to define, and also again the metrics that you use in order to assess the dimension that you have chosen. Okay, so if you focus on psychological implications, you must define which are those dimensions, and which is the metric that you use in order to assess each of those dimensions. So this is the second very important step in your process of designing an economic evaluation. So you define the perspective of analysis. You very clearly define the focus of the analysis. So what you're going to measure in comparing the two or more alternatives that you are comparing among each other. And then we have the third step. The third step is the technique, the choice of the technique to be used in running the economic evaluation. And this is important because, as I anticipated before, we have several different techniques available, and we can choose among those techniques the best one, the most appropriate one for the research question that we have. And this is a very important table that shows us which are the different techniques. And in order to highlighting the different techniques, this chart differentiates the different techniques according to two different dimensions. And you can see the two questions. Do we examine both the cost and the consequences of the two or more alternatives that we are comparing? We may answer yes or no, of course. And the other question is, of the two, do we compare two or more alternatives among each other? Yes or no. So we have these two questions, and according to our answer of each of those two questions, we may have different cells, as you can see here in this matrix. And for example, if we answer no to the question, do we compare two or more alternatives among each other? If we answer no, it means that we focus only on one drug or one new medical device or on a new therapeutical approach. And we may, with respect to the second question, do we examine both cost and consequences? Let's see if I'm able to show you, to move the, yes. So you can see the mouse here, description of results. So if we answer no to both questions, we are, for example, here in this cell, we only focus on one therapeutical approach, and of this therapeutic approach, we only examine the consequences, so the benefits of that specific therapeutical approach. So this is an interesting exercise, is a descriptive exercise. So we are highlighting the benefits related to that specific new procedure. Or we may only focus on cost. So again, an interesting descriptive analysis. We describe which is the cost of the procedure that we are focusing on. If we answer yes to this question, so do we compare two or more alternatives, and we answer no to the question, do we examine both cost and consequences, we may, for example, be here. In this cell, we are comparing, for example, option A versus option B, but we are comparing those two options only with respect to their efficacy. So it's interesting, again, it's an interesting analysis. At the end of the analysis, we will be able to say if option A is more or less effective than option B. So this is an important and useful information, but you know, it's still, there is still something that is missing. For example, in this second cell, we may compare the two or more options with respect to their economic implications. So at the end of the analysis, we may say if option A is more or less expensive than option B. Okay, so again, an interesting analysis, but there is still something that is missing. The best cell, as it always or very often happens in all the matrices, is the one in the right bottom side. So in this case, we answer yes to both questions. So do we compare two or more options? Yes. And of each option, do we analyze both costs and consequences? Yes. So if we answer yes to both questions, we are in this cell and we are in the world of the economic evaluations that we define complete. Again, complete, why? Because we are comparing two or more alternatives, and of each of those, we analyze both consequences and costs. And the economic evaluation techniques that we define complete are these four ones: cost minimization analysis, cost benefit, cost effectiveness, and cost utility analysis. So let's go very quickly through each of those, highlighting the most important differences. So we will be able to understand when it is better to use one with respect to the other ones. First of all, I would like to comment a little bit this chart here. This chart highlights the most important difference among the different techniques. As we said, as I said before in the previous slide, those techniques compare two or more alternatives, and of each alternative analyze both cost and consequences. The unit of analysis of cost is money, is the monetary unit. And this is for the four techniques. In the four techniques, we when we measure cost, we use the monetary unit to assess costs, and this is common to the four techniques. The most important characteristic that differs the four techniques among each other is the unit of analysis that we use to measure the benefits, to measure the consequences. Very quickly, because we will go in more detail in the next slides, in the cost minimization analysis, as we will see in the very next slide, I don't care about the measurement of the benefits, because we assume that the benefits, the consequences of the two or more alternatives that I'm comparing among each other is exactly the same, okay? So I don't care about measuring the efficacy, the benefits. The unit of analysis that we use when we adopt the cost effectiveness analysis, the cost effectiveness technique, is a so-called physical unit or natural unit. That might be, for example, the years of life that we gain in the adopting the different techniques, the different options that we are comparing. For example, the days of illness avoided, or more, or very frequently, we adopt some clinical indicators. But again, just to highlight the differences, because in a few minutes we will go in more detail. In the cost-benefit analysis, as we said, costs are measured in monetary units. And in this technique, also the benefits are measured in terms of monetary units. In the cost utility analysis, costs are measured in terms of monetary units, and the benefits, the consequences are measured in terms of QALY. And we will see in a few minutes what QALY is. And QALY is the acronym of Quality Adjusted Life Years. So the bottom line message of this slide is the four techniques that we define complete, because they compare two or more alternatives, and of each of them, of each of those, they measure both cost and consequences. Have this important difference. Costs are measured in the four different techniques in terms of monetary units. The most important difference is the unit of analysis that we use in order to assess, in order to measure the benefits, the consequences of the two or more alternatives that we are comparing. So let's go very quickly because honestly, this kind of presentation typically lasts 60 hours in a health economics course, but let's try to give to you the, highlight to you the most important differences among the four techniques. Cost minimization analysis is the first one, which is the characteristic of this technique. In this technique, we measure costs in terms of monetary units. And in this technique, as I anticipated a minute ago, the benefits are considered equivalent. So here the assumption is that the two or more alternatives that we are comparing have the same consequences, the same benefits, are perfectly equivalent. So if the benefit is of the two or more alternatives is exactly the same, of course, we will choose the alternative that is less expensive, that is the cheapest one. And this is, of course, always valuable as a reasoning, as a decision, but in particular when we have a public healthcare system where the cost and the expense is paid with public money. So this is the most important characteristic of this technique. We assume that the two or more alternatives that we are comparing are equivalent. So we only focus in measuring the cost of the different alternatives, and then we will choose the cheapest one. So this, what could we comment on this technique? From the one side, it is the easiest one to manage as a technique, because we only have to focus on cost. We don't care about benefits. We don't care about how to measure benefits, because we assume that the benefits are equivalent. So we have half of our problem already solved. We only have to focus on cost and measure costs. But at the same time, it is not very easy to run this kind of analysis, because it is not always very easy to assume that the two or more alternatives are really perfectly equivalent. You perfectly know that there might be differences in terms of administration, in terms of most important characteristics of two or more alternatives that we are comparing that might be a little bit different, and so this might impede you to use this technique. But it is a technique that is very important, and in many circumstances it is adopted. The second, and we may also say the most important, and at least the most used technique, is cost effectiveness analysis. In this technique, costs are measured in terms of monetary units, and the benefits are measured, as I was saying before, in terms of natural units. That might be number of lives saved, number of cases avoided, or, as I was saying before, very often the unit of analysis is a clinical indicator. For example, if you want to compare among each other or between each other two different drugs that have the objective to reduce blood pressure, of course, you may choose as an indicator to compare the effectiveness of these two different drugs, the percentage of reduction of blood pressure using drug A versus drug B. So you choose, in this case, a clinical indicator, a clinical parameter to compare the effectiveness of the two or more alternatives that you are comparing. So this is the most important characteristic of this technique. And in this case, the indicator, the unit of the indicator that you calculate in order to compare the two alternatives is called ICER, or Incremental Cost Effectiveness Ratio. In the next slide, I'll show you how to calculate this, ratio. So the results of cost effectiveness analysis are expressed, as it is written here in the last row, in terms of cost per unit of effort. So this is the most important implication of this technique from a technical point of view. So as I said, you have to calculate the ICER, the incremental cost effectiveness ratio. And you calculate this ratio in this way. You divide the difference between the cost of the two alternatives that you are comparing with respect to the difference of the effectiveness of the two or more treatments that you are comparing among each other. And you can highlight this ratio, the result of this ratio, in a plan that is called cost effectiveness plan. That here you see in the two axes, you have the effectiveness and you have the cost. And for example, if you are in the quadrant number 1, what do you have here? You have that the new procedure, the new drug, the new medical device, the new therapeutical approach is more effective, but it is also more expensive. Okay, so the new treatment is more effective and more expensive than the old one. If you are here in quadrant number 3, you have that the new treatment is less effective and less costly. So here the choice, you have to decide also, as you have to do in this quadrant, which is the solution to adopt. Because in the quadrant 2 and quadrant 4, the choice is quite obvious. In quadrant 2, you have that the new treatment is more expensive and less effective than the previous one. So in this case, we say that the old treatment dominates because the new one is more expensive and less effective. So no doubt, to remain with the old treatment is the appropriate choice to make. If you are here in quadrant 4, you have that the new treatment is more effective and less expensive. So again, here also here the choice is very clear. You have to choose the new treatment because it is at the same time more effective and less expensive. The key difference, the key issue is in these two quadrants, and in particular in this one, because it is the more frequent scenario that we experience. We have that the new treatment is more effective, but at the same time is more expensive. So which option to choose, the new one or the old one, depends on the ICER, depends on the threshold value of acceptability of the incremental cost effectiveness ratio that we have defined before. Let's move to the third technique. That is cost utility analysis. Cost utility analysis is an evolution of cost effectiveness analysis. And in this technique, costs are measured in terms of monetary units, and benefits are measured in terms of utility, that the different treatments or the different drugs or different therapeutical approaches provide to the patient. So under this respect, this is a very nice technique because it analyzes the implication of the different options on the patient utility. So it matches as much as possible the preferences of each single patient. And the unit of analysis that we adopt in ordering in order to measure utility is this indicator that I mentioned before, and its name is QALY, Quality Adjusted Life Year. And the QALY is the arithmetic product of life expectancy times the quality of the additional years that we have to live. And we will have an example in the next slide. This is the characteristic of this technique, and the QALY is an interesting parameter because it catches at the same time the benefits that are related to a reduction of both morbidity, that means the gain in terms of quality of life, and the reduction of mortality, that means the gain in terms of quantity of life. So it's a interesting parameter. Here we can see also in a pictorial way the dimension of this QALY. For example, the area that is the red one, you can see that this might be the evolution of a disease. So at the beginning, our quality of life is at the maximum level. So quality of life is typically measured in a scale that goes from 0 to 1. So you have perfect quality of life. Then the disease gets worse. So you have a decrease in your quality of life. You stay in that status for some time. Then the disease gets even worse. So your quality of life decreases. Then you may stay in that status up until the end of life. What happens if you introduce a treatment, a new treatment on the patient? And let's analyze how this new treatment may impact on the evolution of the disease and of the quality of life of the patient. So this is the area blue. So because of the new treatment, you may live longer in a perfect health condition. So quality of life 1 for a longer period of time. Then the disease gets worse, so the quality of life decreases. Then you stay in that status for some time. Then the disease gets worse, so your quality of life decreases. Then you stay in that status for a certain period of time, and then at the end of life. So what do we have? This final area that is for example, here is the unit of analysis is years, but you may have different, or may have decades, for example, or months or whatever. So the area that is from 4 to 5 is a net increase in terms of quantity of life. And the area that is before 4 and is this one, between the lines red and the line red and the line blue, this is an increase in terms of quality of life during the years that you would have lived in any case, also without the new treatment. Okay, so QALY takes into account both increasing quantity of life and in terms of quality of life. So this is why it is an interesting indicator. So just an example, if you compare two treatments, treatment A and treatment B, to be administered to a patient with a life expectancy of 4 years. With treatment A, you may live 4 years in a health status that has an utility equals to 0.7. If you use treatment B, you may live 2 years in a health status with a utility 0.5 and 2 years in a perfect health that is equal to 1. So which is the quality of the two different treatments? If you use treatment A, you live 4 years with a quality of life 0.7. So to live 4 years in with a quality of life 0.7 equals the living 2.8 years in a full quality of life. So 2.8 QALYs. So 4 years times 0.7 quality of life per year. So this is equivalent to 2.8 years in perfect health. If you adopt treatment B, you live 2 years with a quality of life 0.5 plus 2 years in a perfect quality of life. So it's 2 times 0.5, that is 1, plus 2 times 1, that is 2. So is equivalent to living 3 years in perfect health. So if we compare the two treatments in terms of QALY that they allow to gain, we would choose treatment B because it allows to live 0.2 QALYs more than treatment A. Okay. And as I told you that this is a technique that is an evolution of the cost effectiveness analysis, a cost effectiveness technique. So we may run the same calculation that in this case is not named ICER, incremental cost effectiveness ratio, but is named incremental ICUR, incremental cost utility ratio, and it is calculated dividing the difference in terms of cost of the two options and the difference in terms of utility of the two options. And in this way, I measure the end output of our analysis is the cost per QALY, the cost as utility is measured in terms of QALY. So it tells to you which is the cost that you have to add to cover in addition to have a single QALY gained in an incremental QALY gained. So this is, as I told you, is an evolution of the cost effectiveness ratio, and this analysis tells you which is the cost per QALY gained. The last technique running and very quickly to the end of the presentation, the fourth technique is called cost-benefit analysis. In this technique, costs are measured in terms of monetary units, and in this case, also benefits, also the consequences are measured in terms of monetary units. When do we use this technique? We use this technique when it is very different to compare the two or more options that we are focusing on, because those options are really very, very different. For example, you may have to decide to invest your money, as for example, World Health Organization, in promoting the research for a vaccine against the COVID-19. So this is one option of that you may have for investing your money. Or you may decide or may have as an option, investment option, another very different alternative. For example, you may invest your money in communication, in a communication campaign, in advertising, trying to incentivize the healthcare professionals in washing their hands more frequently than they do today. Because washing their hands more frequently reduces the rate of hospital infections that drive a lot of very negative implications to the patients, to a quite huge percentage of hospitalized patients. So these two alternatives are very, very different. Should I invest in promoting the development of vaccine for HIV, or should I try through advertising to reduce the hospital infections? So very different alternatives. It would be very difficult to find a common parameter able to compare the effectiveness, the benefit that could come from each of the two alternatives. So the only way to do that is to try to translate the benefits in terms of monetary unit. So what do? Of each of the two alternatives, we list the benefits. What would finding the vaccine against HIV mean? It would mean that X people every year would not get the virus. X people every year would not have to be hospitalized. X people every year would not require a test and treatment and so on. What would mean to reduce by 10% the incidence of hospital infections? That would mean that it would mean that X people per year, patients per year, would not get an hospital infection. So you would reduce the number of days of hospitalization. You would reduce the antibiotic therapies to manage the infection, and so on. So you list the benefit and you try to monetize each of those benefits. So at the end, you reach a picture like this one. You monetize the cost of the alternative. You monetize the benefits of each alternative, and then you decide what to do. Which is the one that brings to you, in terms of net benefit, the highest value, the higher value, or in terms of ratio between benefits and cost, the higher return on the investment. According to this analysis, you may choose in an informed way the alternative that you may prefer. The alternative that gives to you a higher, a better return on the investment that you're doing. So these are the four techniques. Very quickly, I have only 2 more slides. Once you have run the analysis, and running the analysis means to define the perspective of analysis, to very clearly define the focus of the analysis. Are you focusing on cost, on benefits, both cost and benefits, and which costs, which benefits? So once you have defined the focus of the analysis, once you have defined the technique to use, cost minimization analysis, cost effectiveness, cost utility, cost benefit analysis, then you run the analysis and you reach a result, a final result. Then the question is, should I rely in a very safe way on this final result? Should I base my choice on this final result? Well, this is not obvious, because in the running of the analysis of the overall study, you have made so many assumptions. So you have to test the robustness of the result. So as I anticipated, the economic evaluations contain a sometimes a high degree of uncertainty and in the assumptions that you make in order to run the analysis. And there are different sources of uncertainty that might affect both the costs and the benefits that you consider in your analysis. So the aim of the sensitivity analysis is to test the robustness of the results with respect to the variation of specific hypotheses or to the value of that of some specific variables. So which are the steps that you have to follow in order to perform a sensitivity analysis? First of all, you have to identify the variables that you want to test, that you want to analyze. Then you have to define for each of those variables a plausible range of value. So, for example, the effectiveness is in 95% of the cases that one, but you know it might be in a certain percentage that X minus something or X plus something. So what happens if I take the lower limit of the values, possible values, or the range of values that that variable can assume? Would the result of the analysis change? And what if I take the the highest value of this range of values for that specific variable? Would the final result change? We have to run again the analysis. If the result does not change, so for example, if the final result is that option A is still more cost effective than option B, no matter if you move the value of the variables, so you can conclude that the result that you have reached is robust, robust enough. So you may rely on that result in making your choices, in taking your decisions. So this is a very important step in this four-step process that characterizes the economic assessment analysis. Then a very last slide as a final consideration that tries to keep together the conclusions that we draw in the previous seminar in February and of this seminar today. We defined and we have analyzed and we have talked about the concept of value. And of course, it is very much important to decline the concept of value adopting the perspective of the payer, that in many countries is a public payer. So typically, the concept of value is declined in terms of value for money, the value for the payer. So the main question here is, which is the return on the investment? I am investing this money to buy this technology, to buy this new therapeutical option. What do I have back? Which is the return on my investment? So this is a very important perspective, of course, but we must never forget that there are other dimensions of the concept of value. Not only the concept of value related to the payer, but also to the user of that technology, of that specific therapeutical alternative, and the value for the patient. So if from the one side, it is very important to assess the value for the payer, the value for money, because resources, economic resources are scarce, so are limited. So we must absolutely, also in terms of social accountability, because again, in many cases, the money is a public money. So we must consider the value for money, so the value for the payer, but we must always also consider the value for the user, that is the healthcare professional, and the value in particular for the beneficiary of these procedures, so the patient. The other issue is that in performing these economic evaluations, we always must, or let's say should, because sometimes it's not that easy, but we try to force ourselves to adopt the broader perspective possible. So we must include, for example, in the analysis, not only the costs that are related to the cost of the new drug or the cost of the hospitalization, but we should also consider into the analysis the direct non-healthcare costs. So the costs that are typically paid by the family, by the patient, by the society overall, like, for example, the indirect healthcare costs. So we should try to adopt the broader perspective possible in order to have a real feeling of the implication of a disease, not only for the public payer or for the private payer, but for the overall society. That includes, in particular, the family and the patient. Then we must include in this analysis the concept of quality of life, and we also may try to use different indicators than the QALY. We may focus on patient-reported outcomes. We may focus on patient PREMs. We may focus on different indicators that are proxies of the perception of the patient and the perspective of the patient. So we should try to focus more and more also on this dimension. Then we should definitely use the results that we may derive from randomized control trials, for example, but we more and more should also to add analysis that are focused on the real world data. So we should analyze the real world evidence and rerun this analysis, like, for example, a cost effectiveness analysis or cost utility analysis, using real world data, data that are collected in real world settings and not in the, let's say, the more artificial settings that characterize the randomized control trials. And as a final message, concluding this seminar, is that we must invest in running this kind of evaluations in a very rigorous way, in a scientific way, because policymakers or also decision makers that are clinicians or hospital managers will have to make decisions. We have to choose among different alternatives. And in order to choose the best option, they must rely on rigorous evaluations, on scientifically based evaluations, on robust evaluations. So we must, at different levels, of course, the technicians, health economists, but also the different level, all the different stakeholders, the clinicians, the policymakers, the healthcare managers, but also the patients and their associations, be aware of the techniques that we have discussed today in order to be able to drive the decisions towards the best ones. So this is the final message I wanted to deliver to you, being very aware that, you know, in 1 hour, it's quite difficult to synthesize, you know, so many concepts, and that typically are developed in a whole course. but I hope that I've been able to highlight the main characteristics and the main differences among the different techniques that we use when we perform an economic evaluation. Thank you very much.
Thank you, Professor Turchetti. Thank you so much. Let's see if the audience has any question. If you have any question, you can either use the chat or the question and answer session.
Yeah, you also have my email. I've written the email in the slide. So if you have later, if you have questions, I would be happy to answer also by mail.
Okay, so I don't see any questions at the moment, so I think we can close.
Yeah.
You can either forwarding your question to him, and I think we will see you again in the next week with the next webinars on health economics. We will keep you updated. And thank you so much again to Professor Turchetti and to all of you for attending the webinar. And see you next time. Thank you.
Yeah, thank you so much and stay safe. Bye-bye. Thank you.
Bye. Thank you.
Bye-bye.